Assalamu alaikum and welcome to Ramadan for Better Health. This program, we're picking health topics and discussing them in depth for the purposes of helping you be successful in fasting during the holy month of Ramadan. The topic that we're going to discuss today happens to do with a particular type of disease that we want you to be aware of, give you information about how to manage it. We're joined by a professor. We're talking about rheumatic disease. We're joined by a professor in rheumatology at Al-Azhar University here in Cairo, Egypt, Dr. Ihab Abdulazim. Salam alaikum to you, Doctor. Doctor, happy Ramadan to you. We hope that you, Allah will accept your efforts in your fasting. Let's talk about rheumatic disease. First of all, before we talk about rheumatic disease, the word itself, rheumatic, what is the etymology, the etiology, the root of this word?
Rheumatic, it comes from Roma. Roma, it is Latin word from pain.
Pain.
If anything pain called Roma or Roma. This is called Roma. But rheumatic disease definition, it is the disease of musculoskeletal joint and the pre-articular joint. This is complaint for pain, swelling, stiffness, limitation of motion, and sometimes lead to other manifestation like systemic manifestation, fever, fatigue, loss of appetite.
So when we say rheumatic, a lot of times we hear rheumatoid arthritis. Does this relate to?
Yes. This is rheumatic disease is more than 300 disease. And the rheumatoid, it is one of these 300 diseases.
I see. So rheumatoid arthritis is one of 300 different types of rheumatic disease.
Yeah.
And when we say rheumatic disease, we mean disease that involves the muscles and the skeletal system.
Yes.
Okay. All right. So today we're talking about one of 300 rheumatic, rheumatic disease in general.
General.
All right. So what about the cause of this? Does it occur because of trauma? Is it because of genetics? What causes rheumatic disease?
Rheumatic disease may be primary or secondary. The primary is called idiopathic. Most of them autoimmune disease. And there is classification of rheumatic disease. We classify it like first connective tissue disease like rheumatoid arthritis, systemic lupus erythematosus, systemic sclerosis, polymyositis, polydermatitis, dermatomyositis, or we can systemic disease like there is due to malignant disease, and also there is called this is type of connective tissue disease.
Doctor, I see in this photograph one set of hands look disfigured. But next to it, there's some discoloration, this darkness on the fingertips. Is that a part of the disease?
This is the first one. This is due to eczema, or in change of the skin color. This is okay with many disease, rheumatoid or systemic lupus or systemic sclerosis. And when the change of the color, this is called Raynaud's phenomena. And this is the second time, this is gangrene, because this is tightness of the vascular, which are nourishment of the joint, lead to closure and the death of the joint, and become black.
So does this mean if the patient has gangrene that you may have to amputate?
Not amputate. This is loss of without any amputation, because this is called of systemic sclerosis, or sclerosis increases the collagen disease in the artery, lead diminish of nutrition. This is part of joint, and the loss of this is joint or tip, like with the diabetes. There is decrease of nourishment and death of the tissue.
Got it. Okay, so it not only restricts movement or makes movement stiff, but it can also restrict the blood flow.
Blood flow. This is systemic sclerosis. Called systemic sclerosis.
I see. All right. So we've talked about how some examples. We've seen some examples of how it manifests and the classifications. We have another slide here.
This is the second type of the classification. The first effect of the connective tissue. This is affect spondyloarthropathy. What is the spondyloarthropathy? Affect of the spine and sometimes the peripheral, but mainly affects the vertebral column.
The vertebral column.
The famous one, it is ankylosing spondylitis. And the second, this is Reiter disease, and also there is reactive arthropathy, and sometimes this is some skin disease like psoriasis led to seronegative in spondyloarthropathy. And this spondyloarthropathy, this is two character, affect the spine, and when this is a test of rheumatoid factor negative.
You said a skin condition called, what was the name?
Psoriasis.
Psoriasis.
Yes.
I thought this had to do with the immune system.
This is most of disease of rheumatic, it is immune. What is the immune? Autoimmune. What is the meaning of the autoimmune? There is disturbance of the protein of the tissue, and the body don't know this is foreign tissue, as like antigen, let do antibody against antigen. There is damage, and autoimmune disease led to destruction of this tissue.
So the root cause of rheumatic diseases of all kinds has to do with ultimately an overactive autoimmune system.
Yeah.
I see.
But not all the rheumatic disease autoimmune. Some which are called degenerative. Like osteoarthritis. This osteoarthritis is effect of the big joint. Most of them elderly people, about more than 58% in the age 50, 60, 65 years. This effect of the knees, hip, and also the hands, distal interphalangeal joint.
All right.
So it is called degenerative. Degenerative osteoarthritis led to pain, crepitation, stiffness.
You touched on something that I wanted to ask you.
Yes.
How widespread is this problem? How many humans are affected by different types of these 300 different rheumatic diseases?
The rheumatic diseases, most of them similar complaint, pain, stiffness, swelling, limitation of motion. But the SCR, or American College of Rheumatic Disease, definite criteria. This criteria, every disease have many characters, and according to this criteria, we can differentiate it between the diseases. Like rheumatoid arthritis, there is morning stiffness more than 1 hour. It take a small joint of the hand or small joint of the feet. It symmetrical, both joints are affected. If we do some investigation like rheumatoid factor or like blood CBC, we can see the difference, thrombocytosis or C-reactive protein. If we do X-ray also, we X-ray in rheumatic disease is very important. We see a change in the bone density, osteoporosis or osteopenia.
So now you've gotten into one of my other questions, how to diagnose, what kinds of tests and evaluations do you perform? You mentioned scans like X-rays to look at bone density and some blood tests. Can you repeat that?
Yeah.
What are you looking for in the blood?
Well, if we do blood picture, we see the white blood cells, we see to the platelet thrombocytosis, and also we see laboratory that like in the
this answers the question about the blood. You're looking for the CBC,
and also we looking for the thrombocytosis, or they called C-reactive protein, and this is immunological test like anti-nuclear antibody, double-stranded antibody,
and so
so on.
So if you see a high level of antibodies in the blood, is that an indication?
Systemic disease like systemic lupus erythematosus. You know, if we found the rheumatoid factor positive with clinical, but rheumatic disease don't depend only on the laboratory. Historical from the patient, take the history good, then clinical good, then the last investigation. Not everyone come to you, right laboratory, and they give more cost and they do image, and then what is the diagnosis? No. The clinical is the best diagnosis for rheumatic disease, because most of the rheumatic disease similar character or similar symptom or similar signs.
Okay, so I hear I see some terms here: articular, in non-articular? Does that have to do with the number of joints involved, or?
Yes, yes. This is articular or non-articular. The number of joint affection according to the disease. If take one joint called monoarticular.
Monoarticular.
Articular.
For one joint.
Less than 4 joints we call buso-articular.
Buso.
If more than 4 joints we call polyarticular. If take systemic manifestation like fever or leukocytosis or other laboratory change, we call systemic type.
Systemic. If it has more than how many? 4 different?
More than 4 joint polyarticular.
Poly.
Less 4 joint we call buso-articular.
Buso.
Sometimes no articular we call when take in the tendon or take in the persa, we call tendonitis or bursitis.
So just to repeat,
I call some people tell this soft tissue rheumatism.
Soft tissue. So just to repeat, when we say articular, we mean the joints.
Yeah, joint. Yeah.
Okay.
Yes.
All right. We have another. These
this
juvenile.
is a picture show us this is a type of juvenile rheumatoid arthritis, because the rheumatoid not only for the adult, also affect of the children from 3 years.
From 3 years.
If the child less than 16 years, we call the juvenile, our children. This is a type, this is monoarticular or polyarticular or buso-articular, and then systemic type, there is rash and the fever. This is a picture very to determine what is the type of the juvenile arthritis belong.
Okay. Does it, I saw in the photographs, the child there had inflamed or swollen joints.
Because cardinal signs, pain, swelling, limitation of movement, and sometimes eczema or sometimes fever. But the child, from the mercy of the God, he not complained of the pain. He play with the pain, but the joint, it is very tender, more than the adult.
I see a picture here of 2 joints. What are the difference between the 2 joints here?
This is the first joint we found. This is normal joint. The last, there is synovial flare or synovial enlargement, led to root of the cartilage, and then disturbance led to effusion or watery of the joint, and then there is redness and limitation or change of the characteristics of the joint.
So it's, I see.
So the child limping.
Yeah. All right. So it doesn't matter the age. It can strike as early as you said, as 3 years old.
So it is the effect of the adult and also effect of the children.
How does it cut short the lifespan of people who are affected by these diseases?
Yes. Actually, the rheumatic disease, about 20% of the outpatient disease in hospital. And more than the 3rd type of disease led to disabled. First, heart disease, then the cancer, then the 3rd type of the disabled or disability. This is rheumatic arthritis or rheumatic disease.
Okay. All right, doctor.
And it led to decrease of the lifespan of the patient because there's movement, physical fitness less than the and also other.
So if someone has something like obesity or diabetes where they need to be more active, it could really complicate their ability to exercise and do that kind of thing. And also, I imagine, perform the prayers. We'll come back to Dr. Ehab, continuing our discussion about rheumatoid or rheumatic diseases. We'll take a short break and be right back.
أفلا يتدبرون القرآن ولو كان من عند غير الله لوجدوا فيه اختلافا كثيرا.
We all know that a person's iman increases and decreases, and the best way to increase your iman is through the Quran.
to contemplate, to reflect, to ponder over the verses of the Quran.
أفلا يتدبرون القرآن ولو كان من عند غير الله لوجدوا فيه اختلافا كثيرا.
In this program, we will listen to the Quran first, and that should soften our hearts. And then once we get to know the meanings and contemplate over these meanings, then we can change by the will of Allah subhanahu wa ta'ala.
ولا يأتونك بمثل إلا جئناك بالحق وأحسن تفسيرا ولا يأتونك بمثل إلا جئناك بالحق وأحسن تفسيرا.
Join us this Ramadan for Quran Circle 2.
Assalamu alaikum. Welcome back to the program. We're talking about the various types of rheumatic diseases. These are diseases that affect the muscles and the skeletal system. We're joined by Dr. Ehab to continue. So we've been talking about the causes and the different ways that it manifests. Can you talk a little bit about the treatments? What are the different approaches to treating people with these diseases?
Before that, I speak about disease, what is the fasting affecting on the rheumatic disease?
Yeah.
Some diseases remission or decrease in the Ramadan because the fasting led to eating, led to no activity of this. The most diseases which are affected and decrease in the exacerbation, like rheumatoid arthritis, and also connective tissue disease, systemic sclerosis, systemic lupus, and other diseases related to connective tissue. But some diseases accelerate because the dehydration led to effect of these diseases, like the gouty arthritis, because there is minerals disturbed in the kidney and led to failure of the minerals in the joint and the exacerbation of the failure of the joint affection and inflammation.
So you're saying that in some cases, not
Yes.
all, but in some cases,
Yes,
fasting can actually improve
in Ramadan,
the health of the
rheumatoid,
patient.
systemic lupus, systemic sclerosis, rheumatoid arthritis, and some cases exacerbate like gouty arthritis and the good pseudo gout, which are called mineral or metabolic disease.
Could make it worse.
Worse.
So it really depends on which condition you have. It can be beneficial or harmful.
And the treatment of Ramadan, we can divide it to before, after eating, or after futur, and after suhoor. We can divide it to 2 doses, not because most of the treatment of rheumatic disease we take morning and at night.
The tablets?
Tablet. So we can give after futur and after suhoor, not give between them. It's like there's the corticosteroid, we can give him after suhoor. And also if he take methotrexate or injection, we can give after futur.
Now, you just answered one of my questions about treatment.
Yes.
You said corticosteroids.
Yes.
This is one of the treatments for some of these diseases. By injection or oral?
Most of the corticosteroid take tablets.
Okay.
So we give that at the night or after suhoor, because the exacerbation of diseases in the morning, the decrease of the morning stiffness at the morning.
Okay.
But the methotrexate or immunosuppressive drug, because needed meal or much meal, so we give after futur.
Okay.
And also the exercise needed, like the osteoarthritis needed strengthening of the muscle. So we give after futur 2 hours.
So exercise in some cases also is important to reducing the symptoms. And
also in the degenerative disease, in Ramadan, it is very good goal for decrease of the weight. Because if decreases about 5 kilo of your body weight, you decrease 50% of the pain in the joint.
Yeah. So if you, for example, have pain in your knees, and during Ramadan fasting, you reduce your weight, that's less burden on your knees.
and also for praying this exercise.
Yeah.
For him. No, I encourage every patient to standing during pray. No, give the chair and sitting with the chair. This is bad behavior.
So we don't want people to hurt themselves, but you're saying that if you can stand, go ahead and don't allow yourself to be to give in so easily and sit in a chair for the prayers, you know, to push yourself to stand up, right?
Yes, and they also for static exercise for the muscle, not for movement of the joint, only stable of the joint and the move of the muscle.
And of course, this is we want people to push people to working with their doctors about, you know, whether or not they stand or sit, you know, for
if severe pain, you can stand and sit, but not every case is to sitting. I want to walk every day, every other day, 2.5 hours to help him to good pray and pray with the standing.
Okay, all right. So you've talked about the fact that this can strike people. What other things can we say about these conditions and the fasting month of Ramadan? You said that not drinking water during the day could help some conditions. What other things or benefits or hazards should we make the viewers aware of?
Decrease of the protein. And also carbohydrate, much of vegetable and the vitamins. And also don't eat much, take much water, not sugar, because the water lead to rehydration of the tissue. And I'll tell you, do some exercises, not only for standing or sleeping, and also the medicine.
Okay.
Before Ramadan, go to the physician or to his doctor to tell him how he take before Ramadan.
Yes, okay, very important. Dr. Ehab is urging us to work with our doctors. We have a phone call right now, Dr. Elmore, Isaid Elmore, internal medicine consultant. Salam alaikum to you, doctor. Can you hear us?
Wa alaikum salam wa rahmatullahi wa barakatuh. May Allah accept your prayers and fasting, inshallah. Happy Ramadan.
Yes, thank you very much, and happy Ramadan to you. May Allah accept your efforts, inshallah. We're talking about rheumatic diseases, doctor.
Yes. When you fast, when you don't eat during the fast, about 8 hours after your last meal, your body starts to use energy stores to keep your blood glucose level normal. For most people, this is not harmful, but if you are diabetic, your body cannot use your blood glucose as well. For diabetic patients, especially if they take certain tablets or insulin, they are at risk of hypoglycemia, or what you call hypos, which is low blood glucose levels, okay? Low blood sugar levels. They also might get into dehydration or even high blood glucose levels following iftar or following suhoor if you eat too much, okay?
Okay, so you're talking about pregnant women during the month. Is there general advice, or is it vary from case to case, pregnant women fasting during Ramadan?
I'm sorry, I didn't get this, please. Can you please repeat it, because your voice is very low, I can't hear it.
I'm sorry, could you repeat that, the answer?
Oh, I cannot hear you well, please.
Yeah, I'm sorry, the quality of the line is not very excellent. I'm just asking you about advice to pregnant women, expectant mothers, fasting Ramadan. What is your advice?
The diet in Ramadan, you're asking about the diet for general population or for diabetic patients?
Okay, diabetic patients.
Yes, if you are diabetic, actually you might not even be able to fast. Okay, some diabetic patients with insulin or type 1 diabetes or have complications, they are exempt from fasting. But others which are controlled with their diet or without problems, without any medical problems, are allowed to fast. But if they fast, they should monitor the blood glucose. We should frequently measure the blood glucose level. If it is below 60, they might have to stop their fast. Okay, when they start to break their fast in iftar, they should not eat too much. Okay, their diet should have more vegetables, more water than any other. Can you hear me?
Okay.
Hello?
Dr. El Said El Moore, he's a consultant with internal medicine. Doctor, we do appreciate you calling in. I'm sorry that the quality of the line was not very good. We're going to cut short our discussion with you, but we do appreciate you calling in to give us your contribution to the discussion. And we'll continue with the program. Dr. Ehab, we have actually reached the end of the program. We have about 1 minute left. If you can give us some final advice for people who have different types of rheumatic diseases who are fasting Ramadan.
First at all, the nutrition of the patient must be rich in the calcium and vegetable and less protein and no carbohydrate much. Second of all, take medicine regular, not stop of the medicine in Ramadan. Third, physical fitness and exercise very good with the medicine.
Okay, all right. Thank you very much, Doctor. This is our guest for the evening, Dr. Ehab Abdul Azim. He's a professor of rheumatology at Al-Azhar University here in Cairo, Egypt. We do appreciate you tuning into the program. Inshallah, we'll continue to bring you discussions of very important health topics to help you be successful during the fasting month of Ramadan. Assalamu alaikum wa rahmatullahi wa barakatuh.